Unlock the future of pathology with Pathology News, your ultimate source for cutting-edge insights, expert analysis, and the latest breakthroughs in digital and computational pathology. Don't just stay informed, stay ahead.
Hello and welcome to Pathology News' latest podcast. Today we're here with DigitCells. My name's Sidney Ocanagil. I'm the marketing director here at Pathology News. And here with me today, I have Dr. Lu, who is the founder of DigitCells, and Dr. Wojno, who's a pathology expert and is an early adopter of the 2D system, which we'll be talking about today. I also have, of course, my CEO and founder, Jonathan Tunstall. And today our conversation is going to focus on digital pathology and how we can enhance the pathologist's workflow using the 2D system. Jonathan's going to kick off this conversation with Dr. Wojno.
Yeah, well, I think initially we should have a chat about some of the challenges that we've seen in the market, because obviously the 2D system is addressing certain challenges. And I think specifically, we're talking here about the challenges about transitioning from traditional pathology to digital pathology, and also the pain points around molecular sendouts and, the workflow and how that is critical to daily operations. So perhaps Dr. Wojno could just ask you to talk about that.
Yeah, just again, I've been doing digital pathology for quite a long time. I stopped looking in the microscope 8 or 10 years ago, and I've tried numerous products. And very early on, I realized that you can't just buy a scanner and scan some slides and it's going to work. It is, as you said, it's all about the workflow, and the workflow starts from the clinic and how the samples get acquired in the clinic and how they get labeled, how they arrive in the lab, how the molecular orders, take place, and then how it's presented on the screen to the pathologist to sign the case out. And I'm a big bugaboo about mouse clicks. They reduce the number of mouse clicks, that happen. And so those are, some of my issues. And then, the speed and how quickly and clearly the images come in, and how the samples are organized on the screen. Those are all things we can talk about. But, again, the big challenge is if you're just considering adopting this, you can't just think about scanning slides and have a pathologist look at it. You need to look at that broader picture of workflow, or you'll fail. Because I've done it the first few times, it didn't work out so well.
Moving on, bringing Dr. Lu here. So Dr. Lu, a company that we've already mentioned called DigitCells, who have a product called 2D, becoming a key feature in anatomical workflow. So perhaps you tell us a little bit about you founding that company and where it's going, and your inspirations for it.
Okay, thank you. Yeah, my name is Jim Lu, and I'm a board-certified pathologist, and I've been practicing pathology for 20 plus years. And first company I started actually is GoPath Diagnostics. That's the company I started, and I've been practicing pathology for 12 years with GoPath Diagnostics. Many people probably know the GoPath. And when we are doing our routine, pathology using the physical slides, as Dr. Warner said, that digital pathology is coming. Everyone is hit this wave of digital. What should we do? And of course, that from my own experience, I had the same feeling that how our traditional pathology is doing. How can we, as a pathology, embrace the digital? Okay, there are a lot of the hurdles, and Dr. Warner mentioned a few. And then the idea of that providing a total digital solutions came to my mind. And I had a relationship with the digital many years ago. I started GoPath Diagnostics 12 years ago. So it clicked on me that I can quickly implement that total digital solution. That's what is the idea behind this. And so we put together of hardware, software, and we built the software called GoPath Pathology Information System, GPIS for short. And this actually is the first LIS system that integrate molecular and the digital and anatomic together. And so within this system, GPIS, that we can click the pathology and the digital, and at the same time, I have a few slides I can show you. But then the idea of the TWD. TWD stands for tissue workflow optimization for digital. This is the system that actually changed our workflow, make the workflow is more efficient, and also the less error, and make sure that the cassettes, tissues travel through the lab without switching to other cases, and also that make it more efficient for digital scanning and reviewing and sign out. And I can elaborate a little bit further, but that's a quick background regarding me and the GoPath and the digital.
Yeah, I think
Digital.
the
Yeah.
key word you said there was efficiency. And as me as a pathologist, when I first started digital, it took me way longer. I think most pathologists, when they try digital, it takes you twice as long to sign out a case. You have to go through a learning curve, and then you become much more efficient. And I will say that I've become a better pathologist on the computer screen than I ever was in the microscope, because it allows you to, annotate and circle the tumor, find the tumor that you missed that's not in the circle. There's a lot of advantages. And so I'm definitely a better pathologist, um, using a digital solution, but it's all about, having those efficiencies in the laboratory, having efficiencies in the clinic, and then utmost the efficiencies for the pathologist. And so I think that's really what the whole integrated system provides.
Yeah, essentially that, how we can doing the prep for our current histology workflow, and to meet the challenge that, or demand for the digital. And that's what DigitCells is trying to do. And the
Yeah.
product of TWD is one of the products. We're going to come up with multiple series of product coming.
Yeah. Okay. I'd like to dive in at this point because obviously, this is a very, very competitive market, and there are many solutions for different aspects of digital pathology. So could we dive a little bit more into the kind of technical side of this? And I'm thinking about what are the different components of the system, and how would you say it is unique in the digital pathology space?
When we designed the TWD system, first we zoomed into the prostate, because the prostate pathology is one of our big anatomical pathology services. So our routine protocol currently is a urologist taking 12 core biopsies and putting in the formalin jar, and then 12 formalin jar, and then when lab receives it, we receive 12 formalin jars. And of course, the tissues, the core biopsies, tissues in the formalin jar will be all fragmented. And this is a common problem with many pathology. We live with that for decades. And technician has to pick up each small pieces from jar and put it in the cassette and then process. There's chance that they missed it, or the fragments, fall through the cassettes, all that stuff. And it's hard to make it embedding and reviewing, reporting. How many cores that the urology really biopsied? Is it 12, 15, 16? We don't know. So what do we need to put over the final report? So this is a thing that, that triggered me to think that, okay, we need to have a new system. And essentially we created a system that, we package it in the kit like this, okay? Then we give this kit to urologists. That's all they need. And even simple that when you open it up, it only contains the few cassettes here, okay? It's here. And this is the cassettes that instead of formalin jar, we create the stuff in this cassette. This cassette, each of this cassette is barcoded. So it's unique. This unique barcode that when the clinician biopsy, they just simply put the tissue in this cassette, and we create this holder, the cassette holder for clinician. You can see we line up this cassette here in the A, B, C, D order, and each cassette has doctor can put 3 biopsy in there, and so for 12 core biopsy, you only need 4 cassettes. Okay, and each cassette is uniquely barcoded, so you will not mix A and B, color coded. And this is really provide really a convenient workstation for urologists. And furthermore, that we create a software to enable the clinician to register the cassettes into the system. Let me quickly show you this.
So can I just then just ask you a further question on this, because you obviously provide the cassettes. Do you provide the other components of the workflow as well?
Yeah. We provide the cassette. Cassette will be free charge to clinician because that's our supply. So we receive these samples. Instead of 12 jars, you only need to have this one kit.
Yeah. But obviously you need to be able to track the tissue as well.
Yes, right.
You need some kind of workstation, probably some AI integration as
right,
well.
Right.
Yeah.
Right. This is a tremendous efficiency with prostate biopsies, because I mean the minimum cores they take is really 12. And so normally we have 12 jars, 12 cassettes, 12 pieces of glass, 12 digital images. And so by starting to compress these down, when you only have 4 cassettes, with it really gains efficiency. Less cassettes, less block, less slides, less digital images for me to look at.
Okay. I'm going to show you that the portal that that urology using connected to TWD system. So you can see that this is they could get to our portal, right? So they log in with they have account, and they put a patient's name. Each doctor has a unique pattern of the biopsies, you said. And so after they put a patient's demographic information, you can see there are 4 cassettes here. They're in the gray. In the real situation, when they're biopsy the one, they just come here to click, scan the barcode that I mentioned on each slide's cassette. And then this color, this cassette will change to the color here. This change to blue. This will change to pink and the green and the yellow. So after they finish that, actually the formalin jar container we give to them is only 1 formalin jar now, a little big size. And the formalin jar has a barcode as well. So they scan that after they put the 4 cassette into the jar. And then they put in this kit and they ship to us. That's it. And the nice part of this portal for clinician, when they finish the biopsy, then they scan this barcode into the system. We immediately know Dr. John Smith had a case and sent it to us, and the 12 core biopsies. And this way that in case the transportation company, FedEx, UPS, if they dropped or missed, we know that this case is coming, where are the samples? And to avoid waiting for 12 days later, clinician asked us, where's my report? We said we never received. So the registration at the clinical site is a deal breaker, and you will actually make the lab is more accountable, and the clinician also feel confident that hey, this biopsy is done, and then they scan the barcode, and this is unique. They know the lab will never mix this with other sample anymore. And of course, that rarely happen, but it does happen. So. And this is the advantage for the urologist. They feel insured, and that the sample is in good hands. So this is from the urology tissue collection side. And so when we receive the cases, and when we receive the cases, and of course that it will be this 4 cassette, right? So when we open it up, and you know that this tissue stayed in the cassette nicely and comfortably, and they also remain intact, not become pieces. And so they all stay here. We just open the lid, and then we put it on the capture station. The capture station is something.
A point to make before you go there, Dr. Liu, is it also maintains the orientation of the needle core. When
that's right. That's another
puts
thing.
The needle
Yes.
core into those cassettes, we know which direction is near the
Yes.
capsule, which end is near the deep end, and that allows us to maintain orientation, which is.
That's absolutely right. And that's absolutely right. And we also can ink tip of the of the capsule or inside the internal side aspect, then we know that which orientation is, and we want to maintain the orientation throughout the process. So when in at the lab, we can just put we can open it up, and of course we remove the leads, right? And then we take this is the digital camera. We can just take the images. This digital camera is connected to our system, so these images will be processed by a small AI program. So all the growth of the biopsy course will be measured automatically by system. So eliminate any work that for technician to use a ruler to measure. Of course, normally they become pieces, even harder to measure it. So for after the image take, you just close the leads and then you process it. So remember, technician hasn't touched the tissue at all. We don't using the twister to remove tissue from another place to this place. The tissue remain inside you and comfortably and before processing. And so this is actually is breakthrough and for this system and make it more efficient. You can go through this quickly. Imagine that the technician has to pick every pieces from formalin jar, not one jar, 12 jars, and not one piece, many pieces. And the efficiency for this system is significantly improved the workflow. Also, the most important that we keep the tissue intact, orientation intact. That will provide pathology a better way to make a diagnosis for better patient care.
Yeah,
No
and
question
this
about it.
taking the digital picture of the gross, it was one of the huge improvements in pathology. And when I started looking at a microscope, there would be a technician who did the grossing, and I would have a textual description of what they have, which is difficult. Now I have an image to look at. When I'm looking at the histopathology, I'm also looking at the gross image, and I can see the core. I can see if it's fragmented. I can see the color of it, the core. I mean, all these nuances that in a typed out written description were very difficult for me to translate in my brain. I think one of the huge improvements going from regular pathology to digital pathology is I get the digital picture of the gross and I get the digital pathology. I can do a much better job moving forward. So that and to take those pictures, people overlook that, but from the pathologist standpoint is a huge improvement.
Also that these pictures are saved into our GPI system or TWD system, and it recorded. That's where we received, and that's because it's real time. And the clinician will agree that that's what tissue we received. Sometimes we have a debate that how many tissues we received. Then the doctor said we only received this. Now this is the evidence, and that's all we received. Okay. So then I put it on the screen is that this is our TWD system, the image view or LI system. We created a special LI system we call TWD Plus system. It's under the GPI system. And you can see that instead of 12 biopsies slides, now you only see 4 slides here on the left side. Okay, because each of them contain 3 cores. And you can see that I can move this up and down, and the tissue get to comfortable resolution very quickly. So this is our system, and make pathology really easy to maneuver and making diagnosis. And also that this is demo cases. There's no patient information. Just let you know. And we also have this is a whiteboard for pathology put diagnosis here. And you can put a diagnosis here. You can. This is a prostate diagnosis panel. You can choose if this is a malignant, what category you can put it here, and all panel is here. So this is actually a very nice system that Dr. Warner already have experience, and he can comment on that.
Go ahead.
Wojno, if we hear a bit more from you, I mean, you've mentioned a few points there, how 2D enhances the pathologist's workflow. Is there anything else you'd like to add?
Oh yeah. I mean, aside from, once you looked at the gross and you're going to look at the microscopic images, having, only 4 slides and 4 digital images instead of 12, and then the images are there they're straight, and you can look at them and they're inked. So I know which of the images belong to A, B, and C. And once you learn that routine, it becomes, very efficient to look at it. I see Dr. Liu moving it around with his mouse. I use a large touch screen. It's like a giant cell phone to me. I mean, I like to, how you zoom in pictures on your cell phone, you can see it quickly. As a pathologist, I almost exclusively sign out with touch screen. So I can zoom in and out. I can rotate. I can get the glands exactly where I want to look at them. And again, as he's showing there's 2 levels on the slide. You can go look at the other level in the exact same spot. Which is always important for prostate pathology, to look at how the glands are evolving in deeper sections. And so and then that whiteboard is very easy, so I can look at this slide, pop up that whiteboard, enter my diagnoses, and then pop it out. In fact, I usually do them 1 core at a time. I'll do that first core, put the diagnosis, pop the whiteboard up, whiteboard goes away, do the next core, and then boom, I'm on to the next slide. And it's extremely efficient, and all those drop downs are all the key components. And it helps remind a pathologist, to make sure they don't forget to put something into the report, because you make sure you fill in all the blanks, whether there's perineural invasion or whether there's, extraprostatic extension, or, the percent of Gleason pattern 4, all these little things are there in that whiteboard to prompt you to make sure you're putting everything in, and then it builds the report for you. So extremely.
Yeah. Yeah. So, right. So the whiteboard is one way to put a diagnosis. We also has another way that you directly put it in your iOS system, that there you can issue report and sign out. I mentioned that you can see that this is the system that digital images and iOS system is fully integrated. This is the digital slides. If I click the case information, then this is all the case information. You can put it here, and you can the diagnosis code. You can put a diagnosis code here. You can work on your report here. Then preview, sign out. You also sign out what you preview and release it. We created the TWOD LIS system basically for this. So independent pathology group can using this, and in addition to what system they have. And we can also do the interface with this system, with the existing LIS system or EMR system. And so make it a complete solutions, close the loop, basically.
Mhm.
And you also can, if some pathology report need a image, right? You don't need for this, you don't need a digital camera anymore. You just do a screenshot. You can do a screenshot, and then it's so easy for me to switch to the image. Then
Yeah. This was a huge improvement. I mean, I've been putting pictures on my
yeah,
reports for 30 years. And so early on, it was a very cumbersome process. But the fact that you can just quickly do a screenshot, and the image, populates in the report. And again, I do like the little whiteboard, because I like to work 1 core at a slide, and one slide at a time. But then I like to go to that overall summary that Dr. Liu showed, to just, proofread everything all at once before I look at the, assembled PDF report, and then sign it out. So.
yeah. When I'm showing this, is got locked out. You can see how quickly I can get back to the case. So then the nice part is that what Dr. Warner said, that you can either using the whiteboard or using our full information system to work on. And another feature I want to mention, that we have this unique and a QR code system. And this QR code that if you scan using the cell phone, you can see the image right away. Actually, you can scan this QR code through the screen, and you can image it. You can see these slides. Then, if I have a case I want Dr. Warner to take a look at it for me, I can simply just share this QR code to him. This is de-identified. There's no patient information. He can quickly tell me that, hey, this is ASAP and a small, or is a high grade, and or the perineural invasion, etc. And this is provided very unique features.
Right. And to talk with clinicians, when I'm talking with clinicians about cases, it's often very helpful to have the image right in front of them. So if they're on their phone or whatever, and I send them the QR code, I go, take a look at this image, and I can point out the feature that I'm trying to talk to them about.
That's great. Have you done any sort of more extended beta testing? Or the 2D?
Yeah, and we have officially launched this system, 2D system, at the AUA meeting this year, and
Hmm.
we are choosing several beta site to test, and it has been very successful. And so the cases get us very quickly, and nurse and the physicians are very happy with the system, and it make the whole lab process, is much smooth and easy, and it definitely is it's kind of fresh air to the histology lab. They handle the 12 job ops, and now they handle the cassettes.
Yeah.
It's a change, definitely.
Yeah. So I'm trying to sort of get to the, the, the real life improvements that, for the sake of the people listening to this podcast, what are the real life improvements? And what I'm hearing is, workflow, efficiency, and it's probably all, there are benefits there for the patient, right? In terms of getting to time of diagnosis.
Yeah, and in addition to the efficiency and the cost saving is also it's another important
Huh?
aspect. Imagine you need 12 jars, that's the cost, right? Now you only need 4 cassettes, and you should have four regular cassette. Now you're only using 4 cassette, and
Uh-huh.
throughout the process. Then instead of 12 slides, you only have 4 slides, and for storage, for digital image storage. Now you
Yes.
might only need to store 4 slides instead of 12 slides. So it's all saving all around. And this is, every lab will want to cut the cost, right? Look at the bottom line. And the GoPath is as well. So this is actually the significant changes. And not only improve the efficiency and then saving the money for the lab, and to make urologists, clinicians more confident. And at the lab, they don't need to worry that where the sample mix with other.
Yeah. The patient safety, I was going to say, you just mentioned it, but with less cassettes and the cassettes never opening again until they get to the lab. I mean, you can assure your patient that there isn't the chance of the rare mix up that does happen. I mean, the more parts, the more moving parts in the system, 12 cassettes, 12 slides, 12 of the, by reducing all of that and having this barcoded system from the beginning, it becomes a great patient safety, advantage for patients. And then the feedback from all the urologists that I work closely with is they don't like putting them in, having all those jars, the separate jars that they had to put the cores in. Now they have this nice compact board that already has the 4 cassettes on it. They're all oriented. They like to keep that orientation of the needle. They just take their needle gun and put the needles on each of the cores, shut the boxes. And so the clinicians are happy, the patients are happy, the staff that are entering in the computer, the interface has been well received with the offices that I work with. And again, then Dr. Lewis, talked about the laboratory workflow. And then again, from the pathologist standpoint, just the efficiencies of the digital system and how easy it is to use. And you can always on them about reduce a couple more mouse clicks, because I count my mouse clicks because I send out a lot of prostates every day. And here's another mouse click you guys can get rid of, and they can be very responsive and taking care of it.
Yeah.
I mean, that's a nice way to think about it. Mouse clicks, isn't it? And improving efficiency and ultimately patient care as well with turnaround time.
One thing we
Yep.
haven't talked about yet is the molecular ordering. I know
on.
we mentioned it at the very beginning. But again, with most
Mhm.
prostate tests or most prostate biopsies that I deal with on a daily basis, the doctors want a molecular test, and they want it as quickly as possible because they want to be able to talk to their patient about it. Whether it's a benign biopsy and they want to talk about the need for a repeat biopsy, or whether it's a positive biopsy and want to talk about active surveillance, or if it's more advanced cancer and they want to have that discussion, they want the molecular test done. And so all of the most of the urologists that I deal with, they order these molecular tests up front in a reflexive pattern. Like if the biopsy is negative, I want, say, a confirm MDX, or if the biopsy is positive, I want a Polaris or a Decipher. They all have their preferences. They all have if it meets this Gleason grade and PSA criteria, that's the test they want. And so from the lab standpoint, the day that I sign out a test and the molecular ordering is all built into the information system that we're talking about, I click a button and then the laboratory knows to package those slides up and send them right to the molecular testing company. So by the time the doctor sees the patient, he can have a discussion, your biopsy's positive or your biopsy's negative, and here's the molecular testing results. And then here's the recommendations. Recommendation, you should go on active surveillance because of this A, B, and C criteria. And so that efficiency that's been gained is, again, a huge benefit to the patient. They don't have to come for one visit to just find out they have cancer, and then they got to wait 2 more weeks to find out what they're going to do with their cancer. And then they got to wait, again, we've saved visits from the health system by getting this whole efficiency thing done. But it's the key about molecular ordering used to drive me as a pathologist crazy in the hospitals or in the other labs that I work, because it's a lot of extra work to go back and do it after the fact. But if you could do it all on screen right when you're signing out, it's tremendous advantage.
Yeah,
Right.
and to facilitate that, the key is that you need to build a system that combine the molecular, digital, and anatomic together. And the system that we create, GPIS/TWD system, and just did that. And also that because GoPath is also a molecular diagnostic company, we run a lot of the molecular testing, including flagship product called Prostate Now, and it's germline testing for prostate. And we built the condition order, as Dr. Warner mentioned, into system. Actually, each facility and each doctor, customized to each doctor. Each doctor has their different preference. So we build that. When doctor pathologists sign out the cases, review the cases, we automatically detect what is the potential criteria and the diagnosis, Gleason 3+4, 4+4, or above. Then we pop up a reminder, say, hey, you need to do this test. Confirm yes or no. And this will make this workflow so efficient and much, much improved, for today's, digital and the molecular workup.
So going back to the roadmap, where do you think DigitCells will go? Are we going to look at new anatomical workflows outside of prostate, and look at GI and other specialities?
Yes, and so these cassettes, this entire system, currently is, the patent pending, and we are extending to the GI now, and even essentially this system can be used for all biopsies and all the biopsy work, and it doesn't matter how you design the cassettes. And so this is the essentially that we minimize the work that technician has to pick up the tissue from formalin gel. That's the essence. And then everything else, it follows through it. Efficiency come with it. Yes, we do want to expand it to other subspecialties.
Right. I think the prostate just really highlights, prostates and GIs where the doctors take multiple biopsies from multiple locations.
Yeah.
You can really see the enhanced efficiency, but again, even today, I sign out all sorts of specimens on the system, from complex, large specimens like an orchiectomy specimen to, skin specimens to other things that again, each have a different unique opportunity for efficiencies. But again, overall, digital pathology solve a lot of problems.
So for the GI system that, upper and the low, you only need 2 cassettes. And one is for up, one is for low. And that's the future. And if you think that we've been practicing our normal way, traditional way for so many years, this is really bring fresh air, a new landscape to our histology, and practice, or pathology practice overall.
And Dr. Wojno, was it a big implementation process?
It's always a learning curve. It's a learning curve for the offices. You need to train them, but once they're trained, they find it much easier than what they were doing before because they only have 1 jar to deal with instead of 12 jars of formalin and a prostate setting, but no matter what type of specimen it is. And then from the laboratory standpoint, it's again, it's just really work reduction for them because they're processing less slides, less blocks, less all of this. There's really no extra difficulty in what they're used to doing as far as embedding the tissue and cutting the tissue. And so I found the lab implementation is easy. Again, there's the software piece. Whenever you change software at any place, it takes time for the clinic to learn the software, your lab to learn the software. And then even as a pathologist, but again, I've used a lot of systems, and this system is very easy. The learning curve was tremendously fast compared to some of their systems that I've tried.
Mhm. And then what about AI integration? Because I know we briefly touched on that earlier. Is that a sort of planned future enhancement to development?
Yeah, right. And DigitCell is working with several prominent AI company in the countries, and we want to bring this to the market quickly, right? So we cannot write all these hundreds codes by ourselves for algorithm development. So our strategy is to work with AI companies, and we're working with several AI companies now. We're co-developing and the prostate diagnosis AI system algorithm, and we are in the process of integrate this algorithm into our system using our cases, our archived cases to train this system. Then we'll co-develop or we'll co-publish the papers, then establish the AI status in the field. And this is actually very significant for us to work with AI company. And our goal is to provide the AI tool for our clinicians, for our pathologists within our network. Currently, because of our digital capability, we're working with many pathologists that the 1099, remotely using our system, and this way that we GoPath can grow our business, without hiring so many pathology on site. It's hard to find a pathology now. So this is digital. This is another benefit of digital pathology. It really enable us company like GoPath to grow rapidly. And so AI definitely is another tool that we create. And in addition to TWD, because the three cores on the slides actually is easy maneuver than the 6, 4, or many other. So 6 is perfect. You can see they're reasonably spaced, and for AI to identify which core is which, and is much easier than too many cores on one slide. And of course, if you put one core on the one slide, is reduce the efficiency. So I think the 3 is the perfect numbers.
And then, I think we're seeing at the moment, this is a very much, it's a moving market in terms of AI, but I think what we're seeing right now is some of these prostate algorithms are really very powerful. Some from different companies, obviously they're variable, but there are quite a few cases now where the prostate algorithm is at least as good.
Right, right. I've used a lot of the algorithms, and they are very good. And I've actually helped train a lot of the algorithms, collaborating with many of the companies. But we're at the juncture now when we need to work on monetizing it. What happens right now as a pathologist, they test out the system. I like it. It's going to make me more efficient. But then they want to charge me for the system, but there's no way for me, there's no billing code for me to charge, say, the insurance company or the healthcare system to balance out that efficiency. And so there's where the rub is right now. Most pathologists, they play with them, but they're not ready to implement them because we haven't worked out the financing.
Reimbursement.
Yeah, that definitely is a pain point that to be resolved. For DigitCells, because we're working with AI company, we made the contribution. So down the road, we should have a very good discounted price. Then we can pass this to our clients, to our pathology within our network. That's another way to get to lower the bar for the entrance of AI.
But I encourage all pathologists, and when I sign out every day, I do put the digital pathology sign out codes on all of my cases, along with the standard CPT codes. And CMS, they're collecting that information, and then they're going to come up with the fair market value pricing and all. So it's a process that's ongoing, but I do encourage everybody to always put those additional digital codes on all the reports.
Yeah, and GoPath is total digital now, and so we put all the codes, that CMS code, even though you don't get paid, but we like to contribute, and in the digital pathology industries, right? So we want to know CMS know that, hey, GoPath is using the digital. We put the codes there, and that's something that we like to do, make a contribution.
I think most pathologists today really use the digital when I've used them, for quality assurance, to make sure you haven't missed anything, to make your sign out more efficient. But one of the other big benefits I've seen is, the group of pathologists, if you're using computer assisted grading, your grading reproducibility becomes much better. And so, you're much more likely, again, if you look at the studies out there on variability even amongst expert pathologists. I mean, I think the one study I was on many years ago, it was like 43% of the time we agreed on the Gleason grade. It's not very good, but you start adding that AI in there and you start to get some really tight reproducibility, which just makes the whole system better, the treatment protocols better and everything. So
Yeah.
I really see a great future for the AI.
Yeah. And I think in the next 10 years, the price of these AI algorithms is going to come down. It's becoming more competitive. And we also have, generative AI programs that are developing so quickly
Yes.
at the moment. And you can see, particularly for screening algorithms, not necessarily diagnostic, which require validation and of course, subject to regulation, but, for screening algorithms, anything working in the background, which is working as an assistant for the pathologist, then I can see the price of those algorithms just coming real down to becoming a commodity really, in 10 years time. So, quite hopeful of that really. I mean, that's a win-win for everyone.
Absolutely.
Yeah, I like
close?
to maybe touch a little bit on the hardware as well, because that's actually one of the things that pathology or pathology groups that usually they're facing, right? And the costs, how to integrate the hardware, software. And, luckily that actually DigitCells went through all that, So, and, we have access to a very affordable scanners, high quality, low cost scanners. And with all the different the capability, 5 slides, 10, 12, 40, and 120 and 400 slides capacities to fit with the different needs of the community-based practice. And then we build a software on top of that, so it creates a seamless connections. All the slides scanned, let's say 400 high throughput, and automatically upload to the cloud. And we also build a system that you can recognize this which pathology these slides should upload to and to the queue, right? So this is we create a system, we call auto allocations system, and this is also very important if we're talking about implement the digital solutions to pathology group, especially the vast number of community-based practice pathologists. And another advantage we didn't touch it that, when we are digital, you make the consultation, much, much easier, and you don't need to stand the physical size and wait for the received, and then wait for the accession, all the stuff. You can we are creating system that for the digital consultation.
Yeah,
Much
yeah. With that
easier.
QR code that you showed, again, one of the banes as a pathologist is my existence is like when the patient, I'm in a private practice, and when they're going to the hospital to have their surgery, the hospital wants to review the slides. I got to package them up, put them in FedEx. I got to send them there. I got to have somebody return the slides so my people can file them back because I have to maintain them. To be able to just send the QR code to the hospital and let their pathologist look at the digital image, number one, it's really quick. People get their surgeries delayed because they're waiting for the slides to show up at the hospital. Here, it's instant. QR code. Pathologists can look at it, they can have their surgery.
Yeah. And, Dr. Wojno is in the community-based. I'm in the kind of independent laboratory practice. I mean, this system actually not just for these two settings, right? It will fit with the academic center as well. And, many academic are adopting the digital quickly. But this workflow still need to work out. And the TWOD system is just one of the big improvement that can really bring the digital pathology more efficient and more adaptable to many people that they may have hesitations sitting on the fence. And that's part of work we're doing.
Superb. Well, as I said earlier, thanks everyone for joining. Fantastic conversation. If the listeners do want to check out DigitCells and learn more about 2D, then you can head over to Pathology News and have a look at their company showcase and product showcases. All of their scanners, which Dr. Blue just mentioned, are on there as well. So please go check this out. Thanks all.
Thank
See you on the next one.
Yeah.
Yeah.
Thank you for listening. Thank you.
Next time. Thank you.